Hello all, I am Dr. Devender Singh, Senior Vascular Surgeon at Yashoda Hospital, Somajigoda. Well, we all know about heart attacks, we know about brain attacks like strokes, but we are not aware of leg attacks. Ladies and gentlemen, leg attacks are very common, much more common than a heart attack or a brain attack. Whenever there is a blood supply which is stopped in any part of the body, leg, hands, in the abdomen, stomach or any other part of the body, it leads to a kind of a leg attack. Patient will suffer with lot of pain, not able to walk, they will have numbness in the legs, they may have color change in the leg, and they may experience lot of coolness in the leg. These are the patient where we should suspect a leg attack. Patient who smokes, uncontrolled diabetes, patient who has been having hyper blood pressure which is not under good control, patient with heart issues, brain issues, kidney failures patients, these are the patients which are more prone for these kinds of attacks. We should be very careful in these patients because these are attacks which may leads to lot of morbidities in the form of losing a leg, or sometimes that can be a life-threatening conditions also where the mortality is very high. So patients who's been having these kind of attacks should be immediately rushed to the hospital, to a tertiary care center where there is a facilities for vascular treatments. Time is very important. If the patient comes in within a golden period of time, that is within 6 hours, these patients can be managed without a major disabilities in the form of amputations. We can actually manage these patients with some time with medical management. If required, if the patient comes within time, maybe very small surgeries, and we are also prepared if suppose the patient has got some major issues, we can as well go for kind of a bypass operations. We can have an endovascular interventions in the form of putting a balloon, stent, so and so. Ladies and gentlemen, these patients are not uncommon. They're very common. Only thing is we have to diagnose this patient. Most of the time these patients, they go to a neurologist thinking that maybe some kind of a neuro event. They go to the orthopedic doctors thinking there is some issue with the bone. But patient who has been having heart issues, patient who has been having brain issues, patient who are smoking, diabetes, one should suspect that there is something wrong with the vascular system, and these patients to be referred to a vascular surgeon or vascular institute, because timely referred patients, I think we can not only save the patient's leg, we can save his life also with minimal finances involved. To conclude, these patients, we should be diagnosing these patients where patient who has been having diabetes, they are smoker, sedentary lifestyle, obese patients, because if we can diagnose these patients, we can manage these patients with lifestyle modifications. Thank you very much.